are arteries that you should know about. So arteries take blood away from the heart. Coronary arteries are, and you know what I'll do is I'll actually draw these arteries for you guys. I'll draw them for you guys. And after I'm done with this vascular system, I'll stop. I'm just gonna do this vascular system. Let you guys go back to your medical assessment. Okay? Okay, so let's do this. So the big old heart.
4 times 8. 4 times 8. Or 8 times 4.
Alright, so the coronary arteries, actually I'm gonna start with the aorta, then go up to the coronary arteries and go back down. It'll make more sense like that. Alright, so this is your heart. From your left ventricle, if you guys don't know this, please write this down. The left ventricle, I'll put LV, pumps blood to your body. The left ventricle is the chamber in the heart that actually feeds the body. From here, the blood will go to the body to feed the body. Okay? So from here, all this blood will get pumped out through this big old vessel that leads through the inside. So it literally leads through the inside of the ventricle and it goes to the inside and it comes out the top. Okay? Okay? This is called the aorta. That is the biggest artery in your entire body, the aorta. And I'll put it in here, aorta. Okay? The biggest one in the entire body. You guys kind of catch up? Alright, so as this is leaving, you got these little vessels that branch off from it and go over the heart. So imagine in my hand, this fist is the heart. This one is the aorta, right? This arm. As it's leaving the heart, you're gonna have these vessels that branch out from it and go over the heart and kind of grab the heart. Okay? So these vessels are the vessels that feed the heart itself. So as blood is leaving with a whole bunch of oxygen from the left side, it's gonna go up and then some of it's gonna go through here. It's gonna be squeezed through here.
Do we know if Aubrey is done with school?
Okay? And so these are the coronary arteries, and they are the ones that actually feed the heart itself. All right? Coronary arteries. These right here that go over the heart, coronary arteries. Coronary arteries right here. Now let's go into the pulmonary arteries. There's 2 of them. Okay? There's 2 pulmonary arteries. I'm going to use a different color for that. Okay, so before the blood makes it to the left ventricle, it gets dumped in there from where? From the left atrium. Blood's always going to come in from the top and go down. Make sense so far? It's like blood's gonna come in from the top chambers, and then go down through those valves that I just talked about, tricuspid and bicuspid valve. Okay? So blood's gonna go. So from here, before the blood even gets here to go to your body, the left ventricle, it's gonna come from your left atrium. From your left atrium, the blood is actually coming from your lungs. All right? So from the left atrium, that blood that has a lot of oxygen so you can push it out came from the lungs so it can get that oxygen so you can take it to your body. That means it's making sense, right? Cool. So from right here, I'll put these as the lungs. These will be the lungs, right? So it comes from here. Well, that big old vessel that takes blood that has oxygen from the lungs into the left side of your heart, it's called the pulmonary. What do you think? It's going to the heart, so it's called the what?
Artery.
Vein. Veins take blood to the heart. Veins have used up blood. Veins have used up blood. Takes it back to the heart. Okay? So it's like the back. This is the only one that doesn't have used up blood. This is the only exception because it's coming. Okay? So pulmonary vein. Okay. So if blood has to go to, if blood that is coming from the lungs has oxygen and it goes to the heart to get pumped out, then blood must have came to the lungs before it had oxygen, right? Because it had to come in to get picked up. So where do you think that blood comes from when it goes to the lungs that has no oxygen? The right ventricle. Okay? You really have like two pumps in one. You have a right pump and a left pump. It's really two pumps that are just kind of put together. Almost like having twin engines. Okay? Alright, so from here, the blood is going to come from the right ventricle. Alright? From here, this blood has a lot of CO2. Alright? Almost no oxygen. Well, from here, it actually goes to the lungs. Okay? This has CO2. CO2 goes here. Right here, we pick up the oxygen, bring it over here, right, left atrium. It goes down via the bicuspid valve, and then from here it goes to the body. Okay, so this one right here on the right ventricle, this vessel that pushes blood from the right ventricle to the lungs to get that oxygen, that's your pulmonary artery. That's this one, pulmonary artery. And this is the one that pushes blood to the lungs to get that oxygen, okay? Now let's go over, we got two more. And then I'll go on to the next one. The carotid arteries, who can tell me what they are? You check them on an unconscious patient. Yep, exactly, right here. So, guys, remember the aorta? Everything comes from the aorta. Every artery comes from, it's the same artery, it's just continuous. We just call it based off where it's at or where it's coming from.
Do you like the little trick I said to get it